Good day, ma'am. I'm Denise Cabiedes and I will be performing the student newborn care checklist. So for the first procedure is to call out time of birth, sex of the newborn, and attach identification bond. So newborn identification is an important nursing responsibility. Nurses must be certain the infant has an identification bond in place so medicine, administration, or performing procedures can be done safely. So there must be two identifiers. So a number that corresponds to the mother's hospital number, mother's name, sex, date, and time of infant's birth are printed on the band. Two bands should be used and attached to the infant's arms or legs because bands can slide off easily. Okay, baby out. Time of birth, 9:38 a.m. Baby girl. Then deliver onto mother's abdomen or into her arms while assessing the infant's APGAR score at 1 minute, 5 minutes, and 10 minutes if response is poor after birth. So rapid cardiopulmonary adaptation if APGAR score is 8 or higher, no intervention is needed. If an infant is obviously in distress, interventions to correct the problem are instituted immediately rather than waiting for the 1 minute APGAR score. The 1 minute score determines how well the baby tolerated the birthing process. The 5 minute score tells the healthcare provider how well the baby is doing outside the mother's womb. So I will do it with abdomen. And then I will be assessing for the skin color, the pulse rate, the reflex irritability, the muscle tone, and the respiratory rate. Then after that is immediate thorough drying. With a dry warm cloth, then remove all wet linen. So apart from protection from cold stress and hypothermia, drying stimulates breathing. It should be the immediate action for all newborns regardless of gestational age or birth weight. The head should be dried well because substantial heat loss can occur from the head, which is about 1/4 of the neonate's body surface area. Then I will now initiate early skin-to-skin contact. So generally perceived to be an intervention for provision of warmth and bonding. Less well appreciated are its contribution to immunoprotection of the newborn and protection from hypoglycemia. The next is the properly timed cord clamping and cutting once pulsation stops. So this is within 1 to 3 minutes. So delayed cord clamping increases the infant's blood volume and iron reserves and reduces the incidence of iron deficiency anemia in infancy. So no milking of umbilical cord towards the infant. When umbilical cord is forced into the baby's abdomen, the pressure can cause tiny blood vessels in the brain to rupture, increasing the risk of severe intraventricular hemorrhage or bleeding into the brain's fluid-filled cavities. Now, I will clamp the cord 2 centimeters using a sterile cord clamp. So, 2 centimeters. And then at 5 centimeters from the base. And then Then I will cut close to the first clamp. So it is recommended that clamping of the umbilical cord is done at least 5 centimeters from the abdominal wall. If the umbilical cord is a broad brace, it is also recommended to clamp at a safe distance from the bases. Premature infants should be clamped longer than the recommended distance for possibility of umbilical catheterization. Then do not apply anything onto the cord stump, such as alcohols or providone iodine or anything, because keeping the cord stump dry is the best way to promote healthy healing and a natural break-off. Alcohols, such as ethanol and isopropyl alcohol, should be avoided. The antibacterial effect of alcohol is brief and can be harmful to the baby. It can also delay the usual 7 to 14 days of cord drying and separation by a day or two. Then, examine the number of blood vessels in the umbilical cord. So there should be 2 arteries and 1 vein. So a single umbilical artery requires search for congenital malformations. In some reports, a significant number of these infants have congenital anomalies, particularly renal and gastrointestinal malformations. So my patient's umbilical cord has 2 arteries and 1 vein. And then non-separation of newborn infant from the mother for initiation of breastfeeding. So the benefits of breastfeeding for the health and well-being of the mother and baby are well documented. World Health Organization recommends initiation of breastfeeding within an hour after delivery. This may reduce neonatal mortality by decreasing the ingestion of infectious pathogens. So after completion of the first breastfeeding, I will now perform first complete physical examination. So immediately after birth, the nurse performs assessments that are most immediately crucial to determining the neonate's health status. This includes cardiorespiratory status, thermoregulation, and the presence of anomalies. So the nurse determines whether resuscitation or other immediate interventions are necessary. When the infant is stable and oxygenating well, a more thorough assessment can be performed. This is also done to evaluate a newborn for maturity and general well-being. So here I will be assessing my infant cephalocaudus, so from head to toe. So I will look for general observations, overall observations, movements, and tone. I will also assess for the skin, if there are any presence of pallor, jaundice, or plethora. And for the head and face, I will inspect and observe for the fontanelle, facial appearance, for dysmorphic features. For the eyes, the cataract, if there are any red reflex. For the mouth, if there are any presence of cleft lip or palate, central cyanosis. And for the chest, the respiratory rate, chest retractions, heart sounds, and murmur. For the pulses, for the femoral pulses, for the abdomen, distension, any enlarged liver, spleen, kidneys, or a mass. For the upper limbs, the digits, does it have palmar creases? For the genitalia and anus. At the back, I will also assess for midline defects, for the lower limbs, and everything that is in the baby. Then I will take anthropometric measurements such as the weight, the height, head circumference, chest circumference, and abdominal circumference. So, vital statistics of the newborns are important determinants used to confirm if the newborn is healthy. Then, I will now perform eye care with erythromycin ophthalmic ointment on both eyes. So, I will apply 1 cm ribbon to both eyes from inner to outer canthus. So this helps to prevent ophthalmia neonatorum in infants of mothers infected with gonorrhea and conjunctivitis. Then, I will inject vitamin K 1 mg IM or intramuscularly on vastus lateralis. So this is also done even in preterms. And I will inject it left anterolateral thigh vastus lateralis area. So this is to prevent and treat hemorrhagic disease in newborns. Then, I will also inject hepatitis B vaccine 10 mcg or 0.5 ml intramuscularly on right anterolateral thigh, vastus lateralis area. So this is for immunization against infection caused by all known subtypes of hepatitis B virus. And then, I will inject BCG vaccine 0.05 ml intradermal on the left deltoid or left upper arm. So this is to prevent severe tuberculosis in infants because the neonatal immune system is still immature. This protects the newborn from serious forms of tuberculosis such as TB meningitis, an infection of the brain, and miliary TB, widespread infection. So here I will be using sterile water instead of alcohol to clean the site. Then I will take the newborn's initial vital signs or the TBR, which is the temperature, pulse rate, and the respiration. to obtain an accurate baseline measurement. So vital signs measurements begin to change from those present in intrauterine life at the moment of birth. And then room in with the mother. So rooming in allows the mother to develop confidence in caring for her baby. It also allows the mother to read the baby's cues to know if the infant is sleepy or hungry. This is a huge help when the mother leaves the hospital. So, hello ma'am, here's the baby. Then, explain all above measures. So, I will explain newborn therapeutics such as administering vitamin K, hepatitis B, BCG, and vaccines, and erythromycin ophthalmic ointment to the mother. So, explanation lessens anxiety, thus promoting cooperation. So, good morning, ma'am. I'm going to speak your news for today. So, a while ago, I have administered some vaccines and ointments to your baby. So I have administered erythromycin ophthalmic ointment to your baby on her eyes, and this is to prevent ophthalmic neonatorum if in case you are infected with gonorrhea and conjunctivitis. Also, I have injected vitamin K in her left thigh. So this is to prevent and treat hemorrhagic disease in newborns. Also, I have injected hepatitis B vaccine in her right thigh. So this is for her immunization against the infection of hepatitis B virus and any known subtypes of that virus. And also, I have injected in her left upper arm the BCG vaccine, on which this will help to prevent severe tuberculosis in infants, because babies have still an immature immune system and they still cannot fight against those severe diseases. That is why the vaccines and the ointments that I have administered will help to prevent and treat certain diseases. So if you have any concerns or you want to know more about information about your baby, just let me know. And then keep with mother skin-to-skin contact and cover with warm blanket and bonnet hat. So this enables colonization of the newborn to maternal flora versus hospital flora to protect against infection and promotes breastfeeding. So this prevents hypothermia and stimulates hormones to support breastfeeding and mothering. I will initiate skin to skin contact. Then keep the newborn's temperature between 36.5 to 37.5 degrees Celsius. So temperature will fall almost immediately to below normal because of heat loss. The temperature of the birthing homes and the infant's immature temperature regulating mechanisms if the baby is not protected from heat loss at birth and in the moments afterwards. So hypothermia raises the infant's metabolic rate and oxygen consumption, worsening any respiratory problems. And then postpone bathing until after 24th hour of life or no earlier than 6 hours of life. So bathing the newborn immediately after birth predisposes him or her to developing hypothermia. When hypothermia sets in, there is an increased risk of infection, coagulation defects, acidosis, delayed fetal to newborn circulatory adjustment, hyaline membrane disease, and intracranial hemorrhage. Bathing also washes away the vernix caseosa, which has been shown in several studies to have antimicrobial properties similar to that of amniotic fluid and the breast milk of the mother. Then, minimize handling of the newborn. So, healthcare workers and family members caring for the newborn should thoroughly wash their hands and arms to the elbows with an antiseptic soap before handling infants. So this prevents or reduces transmission of infection. And then watch out for difficulty of breathing, early jaundice, and feeding difficulties. So any abnormal observations should be referred to the primary care provider or the attending physician for immediate care and management of the newborn. Then lastly is to record all assessments, newborn therapeutics given, and other measures done in the patient's chart. So the infant's chart is also a vital piece of documentation because it serves as a baseline for the infant's health status. It provides information of all measures done to the newborn. It should also contain birth record documentation. So here, I will document all the necessary data such as the name, time of birth, date of birth, name of the mother, and also my significant findings on my assessments and the newborn therapeutics given. So I will record here I have given erythromycin ophthalmic ointment on both eyes, 1 centimeter ribbon. Time is 10:05 a.m. Then I will countersign. And then I have also injected vitamin K, 1 milligram intramuscular on left anterolateral thigh, vastus lateralis area at 10:06 a.m. And then I will countersign. Then I have also administered hepatitis B vaccine 10 micrograms or 0.5 ml intramuscularly on right anterolateral thigh vastus lateralis area at 10:06 a.m. and then countersign. And BCG vaccine 0.05 ml intradermal left deltoid at 10:07 a.m. Then I will sign. So I will include everything that I have assessed and all the procedures that was done. So that's all. Thank you so much.